Good evening and welcome to Psych Incubator and our special show, Eminent Psychotherapists Revealed, with a special host tonight, Dr. Jennifer Kelly, who we are very pleased to feature. Jennifer is a licensed psychologist and board certified in clinical health psychology. She served as the 2021 president of the American Psychological Association. Her presidential initiatives focused on psychology's role in achieving health and racial equity. She is the director of the Atlanta Center for Behavioral Medicine in Atlanta, Georgia. Dr. Kelly addresses a variety of mental health concerns in her practice with expertise in treating disorders that involve the relationship between physical and emotional conditions. A native of Gulfport, Mississippi, Dr. Kelly earned her doctorate in clinical psychology. There's a lot more I can say. I just want to say that I've known Dr. Kelly now for 15 years. She's one of my favorite people, meeting at conferences and talking about all kinds of wonderful things that are going on in psychology in the world. And Jennifer, we're so pleased to have you with us today.
Thank you. It's good to be here.
Jennifer, thanks so much for joining us. I would love to just discover like how you came into the field, like how your life has blended into the work that you do. Anything that you can tell us about you would be welcomed.
Thank you. Yeah, so how did I get into the field of psychology? I grew up in Gulfport, Mississippi, and it is really interesting because if you know anything about the South, and I can't tell you about the North as much as the South, but they have these very distinct communities, and in particular the Black communities. And so I'm in Gulfport, Mississippi, and there are these communities: Gaston Point, Surrey City, Hansborough, and these are all little Black communities that's nestled within the larger Gulfport, as you will. And they're very tight-knit communities. And with the hub of the community being the church, and it's always a Baptist church. So I called myself, and that I am a Black Southern Baptist, because because that helped inform me, whether it was my parents being community organizers during the civil rights movement, and having me to work the polls and all of those things that come with that. So those are the things that informed me. So when I went to undergraduate school, and I was the first one in my family to go to an integrated college, it was University of Southern Mississippi. My thought process was that I was going to be a physician. And I got to the University of Southern Mississippi, and that was in 1975. And they didn't think that I was MD material. And so instead of having me to go into pre-med, they wanted me to go into like biomedical technology or something like that. Mm-hmm. And so it was not interesting to me. But I didn't have I had no one to steer me in another direction or to support me in what it is that I thought I wanted to do. But what happened at age 17, my first semester, Jeff, you would love this. I took Psychology 101, and I absolutely fell in love with it. And just, how the fascination. And I was fascinated by just how powerful the brain is and the mind. And right then, I declared my major for psychology. I kid you not, at age 17.
You were struck.
Yeah, I was. So, don't disregard the importance of that Psychology 101 class to these bright-eyed and bushy-tailed students. And I guess over time, I really could have, as I became more exposed to things, I could have switched my major to pre-med and looked at medicine, but I knew that I wanted to be a psychologist.
We're glad you did.
Yeah. And so one of the things that helped inform me was what happened, what I saw in my community. And we had this tight-knit community and we all supported each other. But one of the things that I saw was just the impact of racism and stress in the Black community. And I was looking at the consequences of that on the people's health. And I was especially seeing this in the Black men in the community. And so at that time, I was really looking at cardiovascular rehabilitation, blood pressure research, because that was the silent killer of Black men. Mm. They didn't have the access to the health care. And even if they did go see the physician, they didn't tell them how important it was for them to take their medications. And if you're having problems with the medications impacting on your libido, don't stop taking the medications. Find a physician that will work with you and getting the medications that can work with you. And the importance of diet and exercise and management of stress, and especially racial stress. So that's what I wanted to have as my area of focus. And that's what I focused on when I applied to graduate school. And actually in a doctoral program at Florida State.
It's fascinating that you focused on the number one like disease that was impacting the Black male community. And that's straight where you went.
And that's correct. And that was all my research in graduate school was on that. And I was really trying to stay true to what I believed in. And I did. And I did. So.
And like if we were to go back in time and you were to use the words that you would use back then about what you believed in, what would you say? Like how would it have sounded in like 1975?
Well, and it's really interesting that the things that were applicable in 1975 are just as applicable in 2024. Is it? I mean, when I think about that so much. Diet, nutrition, effective management of stress, dealing with racial stress. Yeah. The same exact thing. Who knew? Mm-hmm. So they changed the name from behavioral medicine to clinical health. Doesn't matter what you call it, it's still the same thing. Mm-hmm. Right. And just trying to have the healthiest lifestyle that you can have given the realities of the situation in which you reside.
Right, right. And over the years, have you come up like with a formula with the people that you treat that works the most? Like when you sit down with someone, like how do you approach them today? Yeah.
One of the things that and I really work hard at this, and because my patient population, I call them patients, my patient population, these are the people, I call them the poor, the disenfranchised. Mm-hmm. They're not the highest of the educated individuals that you would work with. And I was stated earlier that back in the day, we would call them YAVIS, young, attractive, verbal, intelligent, successful. No. Mine, if you think about that, think about the opposite of that. That's the population that I work with. And so I spend a lot of time trying to help them to navigate the healthcare system. And so if there's something that I would say that would be my mantra is that I want them to be able to take as much control over their health as they possibly can. And that's what I wanted to do then. It's like, how do you take control of your health in seemingly uncontrollable situations?
Right.
So right. Jennifer, are there ways that you could tell us about how to engage the patient population that you're working with? Are there strategies that you use that you might not use with a YAVIS population? What tricks or what strategies have you learned throughout the years in being able to engage people in that process? And is that a problem, or is that, is that something that is a challenge or not? And then if it is, how do you do it?
Well, the first thing that I really make it clear to them is that it's really all about them. And so when they come in and they're in my office and they sit down and they're like looking at this, it's like, I'm in this psychologist's office, and usually they don't, some of them have started coming in on the self-referral, but most of them are referred by a physician or a case manager. It's like, this is just overwhelming. I got somebody that's digging into my brain, and it's like, no, I'm here to help you to be the best that you can be,
Mm-hmm.
whatever that is for you.
Mm-hmm.
And let's talk about, what's happening with you. And it's like, and I start off, I want to know, I want to know your story.
Mm-hmm.
I,
So,
I want I want to know your story.
so Jennifer, you're an incredibly engaging human being. Is that natural? I think it's very natural with you. Is that your secret sauce, or what is it that allows people to engage in this journey with you, who maybe be skeptical or resistant, or have really negative bias about medical practitioners because
Mhm.
of the trauma that we've caused over this
Mhm.
century? Is it you? So that might be a hard question.
Yeah, no, I think that, people have told me this. I was like, what got you in here with me? And what they say is that I'm human.
Yeah.
So, because, they have this thought process of this psychologist being like this, and it's like, no, I'm here.
So
And
you're present, you're
yeah,
engaging, you're
yeah,
warm, you're curious, you're attentive, and you really want to help people.
right. I mean, and this is not like, okay, this is an art. No, it's not an art. It's really what's real inside of me. And I think that they can probably see this human element in me, as they start talking. And for some reason they they feel a sense of comfort in talking with me. And the other thing that's interesting about this is that I think it's gotten a little bit better, that they have the web and people can see things on the internet. But when they saw that name Jennifer Kelly, they think that they're going to this white Irish girl. So, and then when they walk into the office, they say, "Wait a minute, she's like us, she's this black female, and whatever it is she's accomplished, she's one of us." And then and the interesting thing about that, that all my patients I have like 50-50 black and white. So even my whites feel like, you're easy to talk to. You're like, you're one of us. Don't ask me. Now, I don't know how it goes that way, but probably because they have felt not heard for so many years, and I listen and I hear them.
Mm-hmm.
So another
See them.
a follow-up question to that is,
Mm-hmm.
so I think that as you were telling about how you got into this, and I know how you work, and I've known you for a long time. I know your enthusiasm. I feel like you had a calling. And what is there a difference between someone who has a calling as opposed to someone who gets into it because of other reasons? Do you think there's like a difference in um,
I think
medical
that.
psychiatric professionals who,
Mhm.
uh, to me, you have a calling and you followed the calling, and this was what you were meant to. This
It
is your
is
dharma.
the calling. Yeah.
This is
Uh,
your dharma. And so, what do you think about that?
I think that this is where I'm supposed to be. And I don't necessarily say that it's a calling, but when I'm in the room with my patients, I feel that this is where I'm supposed to be, because otherwise would not be doing it.
Yeah, yeah.
Because I mean, the work with the patients I love, but just dealing with all the other factors and variables outside of that can just be overwhelming. Because many times I deal with the disabled person, the injured worker, and there's so many things that are in play. And I have to kind of go through all of that and get to where we are right here, and that's the patient. And I'll tell, like, if I'll talk to a case manager, and I was like, you know what? I am so glad that I really care about these patients, because otherwise I would not be doing this. And
Mm.
they said, well, we're glad that you are. I was like, yeah, because it's like, because you guys are really trying me here. So, I mean, you guys, not the patients, the system,
Yes. Yeah.
the
The
system.
broken system.
Yeah,
But
I said, y'all are really trying me. So I'm glad I really care about these patients. And the
Well,
patients sense that. So,
you said that when I first was able to get in, I heard them saying, "Well, you're one of us,"
yeah.
and you have this wonderful smile then in response, and your eyes change. What do you say to them about being one of us?
And you know what I say? I say, tell me more about that. What do you think? Because I want to know what they mean by you're one of us.
Mm-hmm.
And some of them will say that you're just comfortable to talk with, or someone say you're kind of like talking to, you're like a girlfriend, but an educated, girlfriend. I was like, you know what? In my mind, I was like, long as I can get the results that we need to get. If you want to call
mm,
me your girlfriend, whatever. But you're not going to be calling me after hours like that to be talking. But if you feel if that makes you feel comfortable in getting the work done that needs to be done, I'm okay with that. At
mm,
one time I wasn't, because I was like, I was really supposed to be this, this clinical psychologist, and no, that what you're supposed to do is to connect with the patients to get the results that you need to get.
that's right. Yeah. Well,
You're, go on, sorry, go ahead,
no,
Krista.
go ahead, Michael. I'm
Okay, I'm struck by just how incredibly warm you are and how easy it is to sit with you.
Thank
Yeah.
you.
I think that's a pretty common experience most people have with you, Jennifer. You're,
Is this an intervention, Jeffrey?
yeah, it is. And what I want to follow up with,
What's the
Jennifer, is
intervention?
that I think, what do you think about the idea that when you really feel engaged and you feel like you're getting good results, that that's the best inoculation against burnout? Because the field burns people out. And I'm trying to figure out why do some people get burned out. And I think it's because they don't really get the results that gratify them. They don't get the response that makes them feel like they're effective, and they don't feel the passion of the
Mhm.
work that I can see that you when you're working with people and they're engaged, it's amazing. Do you think that is a protective factor against burnout?
Yeah, I do think it helps, but I can tell you that there are often times that it gets to be very difficult. So one of the things that has happened is that, it's like if you do something and you're good at it, then the next thing you know, that's when the door's opening up and everything.
Yes, yeah.
It's like, wait a minute, why am I getting all these trauma patients here? It's like
Complex
that.
patients,
So,
yeah.
yeah, it's like, wait a minute here. What, it's like, do I have a sign on my, this invisible sign that other people
It's not
see?
invisible. It's that you work with complicated patients, you can engage them and you get good results.
Yeah, and I do believe that that's why I keep getting them. And it was like, I was like, this is unbelievable. And I do and the population, especially since COVID,
Mm,
they've become much more complicated. And so I have to work with myself
mm,
to say, okay, Jennifer, you have to be patient here, because it's going to take you a little bit longer to get the kind of results that you need to get. you have to take care of yourself through this process.
Mm-hmm.
And so I tell my patients they have to do this, but I have to. So I have to manage my expectations. And so I'm managing my expectations, and those are the things that help to keep me going.
Mm-hmm.
And I do see results, but I have to think about the results differently than it was when the patient population wasn't as complex as what it is now. They're very complex patients.
Mm.
So and it's interesting. I have an office manager, and she has an undergrad degree in psychology, trying to get into a graduate program, a doctoral program, but she's worked in offices before with psychologists before. She said, I've never seen any psychologist, work with any psychologist that had patients that are more difficult, as complex as your patients. And I said, yeah, and I do not know where they're coming from. But
Mm.
there's some kind of word that's out there that send them to me, but they
Right.
are. And so on top of the complexity of their situation, where it's a trauma, on an injury on top of that, or an injury and a trauma on top of that, they also are having difficulties in navigating the system. So we're trying to deal with all of that in one. So and so I have to try to keep myself organized in terms of my work with the patient, and in that process helping them to organize kind of the treatment with them as well. So
So a biopsychosocial framework.
my biopsychosocial framework, yes. And I have all of that. I like that. We don't use that word enough, but that was like from the 70s too,
Yeah,
probably. Yeah.
Engel, I think, was the guy.
Yeah.
That was
Yeah, that's
awesome.
right. Yeah.
You
Well,
know,
as
if
Jeffrey was describing you, it was really clear that he was focused on the mind and the body. But then when you explained where you come from and the fact that you grew up Baptist, it was like, oh,
Mhm.
there's the spirit too.
Good
And
point.
and so you're hitting all different types of points when you're working. And I find as I grow older in the field, I realize like, yeah, it is about the mind, body, spirit. Like if
yeah,
I'm not paying attention to all three, then something's usually missing that we
Right.
need to address. Yeah. Michael, I could hear you.
Well, and I think that there are these other things that do make me real, because that was this thought, and I don't know what they're teaching them in school these days, but that was this thought that we would be this blank slate, right? And that no one knows anything. You remember that? Like no one knows anything about you, and you're sitting there like this, and you're stiff like that. Really? How am
Yeah,
I going to get a patient to engage with me
yeah,
like this?
yeah.
And I'm
yeah,
It
like,
causes iatrogenic disorders with many patients when
that's right.
that psychoanalytic, that
Yeah.
neutral, abstinent stance.
Yeah.
And I think it took a long time for our field to realize that that's not therapeutic. That's not a good therapy.
Right.
it's still struggling with it.
We
Yeah.
are. It's been
Yeah.
Yes, we
people.
are.
People
And
still
and
do
and
that.
and I am real, and I do think that there's that humanoid element, because I'm real clear with my patients. If they ask me about my religion or whatever, and my faith, and I'll tell them I'm a Black Southern Baptist.
Good.
And
I'm
I'm not gonna
very
I'm not gonna
transparent.
tell you to go to church or anything
Yeah,
like that,
yeah.
or if you come in, it doesn't matter to me what you believe in or if you don't believe, but I want you to know who I am and the
Yes.
Mm.
framework that I come out of, and that's what informs me in the work that I do with you.
It's very different than the analytic approach
Mhm.
that a lot of us were trained in, that
Right.
you analyze the questions, you never answer them. And
That's right.
I'm so far from that now. I'm so transparent.
Yeah.
You ask me whatever you want to. If I don't feel comfortable answering it, I won't answer it. But it's
Right.
okay. As opposed to at one time, I think I mentioned this before in one of these programs. I was working with this patient that was very, very avoidant and very introverted, and it took me so long to just sit with her and have her feel comfortable talking. And one day she came into my office. This was decades ago. She came into my office. I was in psychodynamic training at the time. And she brought two coffees, one for me and one for her.
Oh,
And I started analyzing why she brought me the coffee. And it
That's
was
right.
the stupidest,
That's right.
worst thing I could have done, as
Yeah.
opposed to graciously accept the affectionate expression. And
right.
that's where I came from there to
Right.
much more relational, like you are.
Right. I mean, you could spend a whole lot of psychic energy trying to analyze that cup of coffee instead of enjoying that cup of Starbucks. Let's just have our cup of coffee together here,
Exactly.
you
That
know?
sharing of the cup of coffee was probably the most therapeutic session that we could have had if I had just graciously accepted it.
Right. Mhm.
Yeah, and think of all the shame therapists have felt when they have accepted it, right? They've
Yeah.
gone home,
Oh,
they got
yeah.
supervision, they thought about it for months on end.
Well,
Was
I mean, that's a very interesting thought, because one of the things that, I don't know what they're teaching them in school these days, but one of the things that we've struggled with is whether or not you would accept a gift from a patient, right?
Right.
And if a patient would bring me a gift card to Bed Bath, a $25 gift card to Bed Bath and Beyond, or whatever it's Bath and Body Works or whatever, well, can I take that gift? And what does it mean?
I know. Rather than just allow them to experience the pleasure of our warm acceptance.
And what they're really telling me, and whenever I sit down and talk about it, they'll say, "You don't know how I feel when I leave when I leave your office."
Right.
And sometimes everything could be so overwhelming, and at least I know that I can be good for 2 days. I was like, okay, you're only good for 2 days. We're gonna extend those 2 days to a little bit longer. But they'll say, it's how I don't have a lot, but I just want you to know that you've made this difference with me.
Yeah, that's really amazingly meaningful.
And I don't even want to go into how have I made the difference,
Yeah.
because I
Right.
begin to
Right.
see how
Yeah.
the difference and I was like, yeah, we've done good work together.
Yeah.
Mm.
So does that mean I should give the Ferrari back that my patient gave me?
But I think you're
So,
bringing up one thing because now we're trained to process, 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 process,
mhm,
and sometimes that can undo the specialness of the moment too,
that's
right?
right.
Like,
That's right.
and
Right.
and I love the moment of meeting, like when you and the patient come together, and there's just that feeling of this is meant to be, this is happening right now, and
Mhm,
and sometimes it's nice just to let it be
mhm,
and to savor it, versus talk it out, talk it
right.
through.
Mhm,
Yeah,
mhm.
yeah.
Do you find that people, in keeping with this theme of their appreciation of you grows and grows, and you and you tell them how much that means to you? I don't know if you do things like that, but I find that the more you share your feelings about it, the better they feel. It's like
Right.
you're really on the same patch of ground, and you tell them exactly what it's like, and that's when you know you both sit there and cry happily together. And
Right.
maybe this is Mother's Day time of year. You can even do a little talking about dear old mom.
Yeah. And one of the things that I have to keep in mind is that with the population that I work with, if you will, they're not like psychologically minded, right? And they come in physical pain, and they've got some trauma, and they just don't understand it. And they feel like they've been beaten down by the world. And they have no one to talk to share those feelings with, because they have the fear that they would be considered as crazy, nobody can hurt this long. Get over it.
Hmm.
That's right.
You
People
know,
don't want to hurt. They don't
yeah,
want to hurt, and they don't
yeah.
want to hear about it.
They don't want to hear about it because they don't want to have to deal with that, but they have someone that will listen. It's like, tell me about that.
Hmm.
Like, you really want to hear about it? Yes. Yeah, I want to know about that. And I help them to normalize those thought processes that go on in their head that they feel so disconnected from the world and even themselves. And let's normalize some of this and the feel, you're going to be okay. I mean, it's like this thing called trauma. Why am I having all these nightmares? And to have someone to help them understand what those nightmares are all about.
Hmm.
Mm.
Mm. And how they feel uncomfortable going into a supermarket. And like, okay, let me help you give you some strategies on how we can deal with this. We're going to get you back and I'll talk about a nemesis. Do you know what a nemesis is? It's like, let's explain what a nemesis is. Let's get that monkey off your back.
Wow.
You can understand
Yeah,
that.
yeah. Well,
Well, I'm, one thing that's been happening for me post-COVID is realizing a lot of people are still in COVID, and I'll meet with them for the first time online. And I
Mhm.
realize, after 20 minutes or so, like, we really have to focus on helping you move, like helping you just move outside of your apartment,
Hmm.
back into the street and into a coffee shop and with other people. And that's been really humbling to just kind of, sit with
Mhm.
a person and understand, like, oh, if we don't get them moving,
Mhm.
then how are we going to address
Yeah.
everything else? So,
And the thing that's interesting about that is that for the patients that I work with, it is so much easier for them to just be inside their home or inside their apartment because they're in pain and they get anxiety when they get out. And so COVID made it easier for them to be isolated.
Yes.
And so then I'm in my office. I I have an office and I go in my office. Many of my patients still would prefer to do virtual sessions, but I'm there. And I tell them, it's really good to get out and experience the sunshine. And I talk about how the world is, getting small and as you get comfortable with it like this, then it gets even smaller and you get more comfortable with this. And before you know it, it's not there anymore.
mm,
It's gone.
right,
What happened to your world?
right, right.
So,
part of growing old also. Just personally, I will turn on a show of some type on TV that looks interesting, and I realize very quickly that I can't keep up with this conversation. It's too
Mm,
clipped, it's too fast. I have no idea what they're trying to say.
mm.
And I'm just, 60 years out of date for these people. So and you see, and I'm particularly with my older patients, um, they talk about, you know, how people look at them and avoid them as if they have the plague or something, just because they have a cane. And I think it's this sense of being outside is really helps if you can talk to them about what it's
Mm,
like and how I feel outside, and then that makes them feel less outside, at least with me. And then if we keep feeling good about something, then we can enlarge the circle in that another person.
mhm.
I think teaching them how to yeah, find people who are interesting, want to get to know you, and you get to know them.
mm.
Well, yeah, and the other thing that's interesting about the patients I see, in addition to them having a chronic pain or chronic medical condition, I'm seeing more amputees. And yeah, so they do look different, right? And
Hmm.
or they are younger people they're using a cane, and so
Why
they
is that? Why is that, Jennifer? You see more amputees. What's the phenomena?
it's a trauma, and they have depression, anxiety. Um,
Why are there more amputees?
what remember I talked to you about I'm having more severe patients? That's what I
Okay. So
said.
it's it's I
Yeah,
get it.
like, and I say the same question. Why am I having all
I was thinking, were you
these
getting people from the Ukraine who were over there?
No.
Because there's a whole generation of people that are amputees now.
Yes, and so I
Diabetes.
haven't gotten any of them yet, but these are
They will
patients.
come.
Yeah, it's been on the job accident, and
Hmm.
they have amputations.
Oh, wow.
Yeah, and I was like, why am I getting all these amputees? Well,
Wow.
because you've done a good job with the other amputees that you worked with.
Wow.
Right.
Yeah, and so I feel so proud when one of my amputees is now driving a truck. I mean we it took us years to get to that point, but he's driving a truck and he's getting his commercial driver's license.
Wow.
And you know what? One of the things that was really interesting that happened with him, and this was a turning point. I just have to tell you this story. He was a black guy, and he would come in, he was so angry, and I can understand the loss. And we talk about the stages of acceptance, and he had all that anger inside of him, and he would just be yelling in the session. And I would, it's like, okay, now the strategy is that as long as they talk, then you talk softer, and maybe they'll talk something. No, it didn't work. So he's yelling, and I'm talking soft, and it is not helping. And I told him, I said, you know what? I said, what concerns me is that you're going to be seen as an angry black man.
Mm,
And he said that's what turned the corner for
right.
him. He
Right.
says, I don't want to be an angry black man. I said, yes, they say that there are a lot of angry black women, but I said, but you're gonna be seen as an angry black man. And that turned it for him. He says, Doc, you have no idea what that statement did to me.
Wow.
Mm.
And so there are many people who would not have the psychologists who would not have therapists who would not have the courage to tell them that.
Mhm.
Right. And it's like, and so if you talk
Well,
about keeping it real, that's
yeah.
one of those things. It's like, why are you behaving like this? You're gonna be considered, and it's like I'll talk like that. Why are you behaving like this? You'll be considered an angry black man.
Mhm.
Mm,
And that's what did it. And I didn't know that would have that kind of an impact on him. But that's what he was looking like, instead of an
I,
angry black man. Yeah.
I suspect you've used that particular thing to understand the defenses and the ways of avoiding you that many people bring in, because I call them people who have a sword and also
Right.
something to guard them. And they
That's right.
every time you get close, they
That's right.
shoot and then back, and then you pretty soon you're.
Yeah.
But when you tell them what's going on and you understand and wondering what they're so afraid of, then they get a little closer.
Yeah. And the interesting thing is I was thinking, it's like, we're just stuck here. And I
mhm,
was like, because I cannot make any headway because you're so angry that you don't hear me.
mm,
And that's all I'm hearing. It's like, okay, we can deal with the stages of acceptance, but we got to move through these stages of acceptance, right? We got to get beyond that anger phase here. And 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 I tell you, once that hit him, it was just, the change and the progress that happened after that.
right.
Who knew? I mean, I was just doing what I could do to help him to move forward.
I think I love the story so much because I've seen it live, and I think a lot of people are scared to speak the truth.
That's what it is.
So
Yeah.
I have a similar when I'm working with some male patients that there's a phenomena that often is evident, and it's when I'm working with a person right now that has been physically abusive toward his child, and he he doesn't he's not physically abusive toward anyone else but his child. And one of the things that I've noticed and that I label is what I call impotent rage. So this is a pretty common phenomenon in the males that I work with. When we feel impotent, it's so easy for us to go into rage because the adrenaline actually is a counterdote to that feeling of impotence. So and that becomes addictive. And that kind of labeling, impotent rage, so many guys that I work with say, wow, that is exactly what it is. Like
Yeah.
I can't
That's
control it, but I'm enraged and the rage makes it worse. It's impotent. And so it's a sign of I feel impotent when I'm powerless. So it's a similar kind of
oh yes.
when
Oh,
you
I
get
get
that
it.
when you capture the phenomena
Yeah.
and you said that, do you want to be do you want to be an angry black guy? It's just, I mean, you just captured it for him.
Yeah.
I have a question. Witnessing is ever so important. How do you support the client with the vulnerability that comes with your compassionate witnessing? How do you
Tell me more
support
about that. Tell me
how do you
more.
support the client with the vulnerability that comes with your compassionate witnessing? I'm not sure, Ken, if you want to type a little bit more in, we can try to get at that. So I'll wait for Ken's answer and then we'll get back to that. Another question here, I think. The same question.
Well, see, I don't know what you mean by the witnessing. That's what I was trying to understand. That if you could break that down for me just a little bit.
Yeah, Ken, if you could add to that, we could help.
I love it that you said that because I think sometimes the terms that we use actually distance ourselves from what we're talking about.
Yeah.
Like, when you were telling this guy that he would look like an angry black man, it's as immediate as you can get with words. It's like holding that mirror up. This is who you'll
Yeah.
look like, or this
There's
is what you
no
look like.
abstraction there. Just
Right,
straight up,
right. And
raw.
people love that raw simplicity, like, oh, I don't want to look like that. And I am looking like that.
Sometimes they love it, but I had someone I was working with earlier in the week, and his partner was talking about how this person never responds to uh, any kind of calls to connect with the person, and that the person turns their phone off all the time. And I said something about, well, I could understand that if you were a neurosurgeon going into somebody's brain and you didn't want to be interrupted, because he said, I don't want to be interrupted. And he just burst out with rage toward me about, oh my God, you just don't understand how much being alone is a need for me. I said, I don't think being alone is a need on any of the need scales. And it just made him angrier. But then he was able to say, I'm neuroatypical. I don't have the same needs that you have. I said, oh, okay. So it was a point of
Mm-hmm.
being able to have a deeper understanding of him, that whether or not it's true, he doesn't feel like he's wired in the same need structure that I was projecting. I don't know. It was kind of interesting to
But
see.
it was really interesting because you were able to get to what he was really talking about and what he was
Yes,
really
that's what it
feeling.
allowed for. I was able
Uh-huh.
to
Yeah.
accept his anger and say, yeah, I
Right.
get why you're angry with me because I don't understand it, but it's helpful when you let me know. So that was
I mean, and I understood why the guy that I was working with was angry. I knew exactly what was happening in his world that made him feel so angry. But what it was doing is that, well, you know what anger does is it turns people off, people who could be supportive of you in the most challenging times. They're not going to come near you.
unless it's calibrated, which means that it's a boundary setting, right? Like you're so
Right.
if it's calibrated, it's appropriate. So Ken says the angry man was being witnessed, being seen by you, first time being seen, and then what to support him living without the anger. Hope this clarifies.
So, right. And so and I think I'm understanding what he was saying. If that anger was his defense mechanism, right?
Mhm.
And if he did not have that anger, then he would be wrong, right? That would be what would protect him. And that's what we work on in treatment.
Mhm.
We got
Mhm.
to, I mean, but if I can't tear those walls down, then how can I get to work and help him to build up things in a healthier way and help him to get a sense of control in seemingly uncontrollable situations?
Yeah, that makes sense.
So I mean, so and it clearly was his defense mechanism. It was his protective wall. But it impacted on him being able to get the physical care that he needed to get, the legal assistance, because he just pissed everybody off. That
Didn't
was the wrong
scare
guy.
you away.
He just scared me away. Yeah. He just scared me like, okay, you're gonna come in here and fight at me today? Yeah, right, okay. How much money am I gonna be getting to be taking this abuse from you today? No, I'll just so no, but I didn't want him. I felt that it was time to tear those walls down and let's grow. And let's be
Right.
vulnerable. And keep this in the context that this is a person who had never been in therapy, all his life.
Mhm.
I mean, he's a 40-something-year-old Black male, and the only reason he came into therapy because they could not deal with him anymore because of his anger. The medical system sent him to me. And he's wow, he's progress. He's working and he's having a living. So
Now that I think is what feeds you, right? That
I know.
when you get those kind of
Yeah,
results, it
right.
makes you want to go back and it makes you want to learn more and it makes you want to grow more and
Yeah.
you've gotten better at working with complicated
Yeah.
patients and you're getting more complicated patients, but
I get it right. I'm getting more complicated patients because, you
you're
know,
getting
we
better.
we work, yes,
Yeah.
we work hard together.
Yeah, I think that can be a phenomena as one of the good things about aging as a therapist, if we don't go senile first, is that we can get very expert if we keep training and learning and growing. And that can become amazingly gratifying when you get like Lampert's work was at the top tier of
Mhm.
therapists get the best results and they get them fast. And I think that's probably one of the most gratifying things. Like, not everybody
Yeah.
we get that with, but when you work with a complex patient like you do, and you get those results and you get them in a reasonable amount of time, it feels great. It's like, wow, I am
But
really making a difference.
and it's interesting that you say this and you bring up the aging thing because I was like, you know, I'm getting towards the end of my career and I'm really I'm really getting good
Getting
at this.
good. I'm finally getting good at this.
It's like, but I'm getting towards the end of it. It's like,
That's, that's
why?
not fair,
Well,
right?
it's just the
Why
beginning.
the
I'm
break so
finally getting good at this, and now I
and
gotta
now and then I'm in the third trimester of my career.
right.
So
Yeah. So
how did that end up happening like
you'll have a
that?
second career.
Yeah.
No,
So
I agree. I think it's an interesting phenomenon, and it
I think
probably
it's
in a lot of professions that as you get really good, and
yeah.
if you keep working at it, obviously, I mean, not everyone advances, but if you're a continuous learner, and if you want to grow, and you do, obviously, you learn and you want to grow, and it's the most amazing privileged thing we do, really.
I think you're right.
Hard, hard.
I think it gets actually easier as you get older in many ways because you're covering up less.
Yeah, Yeah,
You don't have to be cool or anything. You can simply be there with them
yes.
and let them be there with you and talk about the stuff that's important. You both
I
can
agree with
understand.
that.
Yeah.
It's almost like my heart aches more quickly, right? Like
Mhm. Right.
okay, what do we need to do? Yeah.
One of the things I wanted to talk about, Jennifer, obviously there's a lot of positive feelings in relationships that you had toward your patients and them towards you. What I have been noticing more recently is when I focus on affectionate feelings that, like I was validating someone the other day, and the person said, I could see he couldn't take it. I said, "How do you feel about what I'm saying to you?" And he's like, "Yeah, I just want to get back to work." I said, "Well, hold on a second. How do you feel about what I'm saying?" "Well, you're validating me, and I want to get back to work." I said, "Well, just hold on a sec. It seems to me like we have more trouble as therapists and the people that we work with affectionate feelings than we do with the angry ones, right? The angry ones are so much easier to, I'm so angry, but wow, I really, I
Mhm.
really feel warm and affectionate to you because whatever. And how do you work with those positive feelings that are brewing in your relationships with your patients? I can tell. How do you talk about them? Do you share them? Do you?
It's really interesting that you say that.
Mm.
I think that one of the things that I want, I try not to just focus on the negative aspects of their life because I mean well, that could take the full session. But one of the things that I like to talk about is the growth that they've had, and I don't think that we do enough of that. We don't do enough of talking about, where I mean, my patients are more a longer term patients, most of them, where you were 2 years ago. And
Yes, yes,
let's look at where you are right now.
yeah.
And, and it's like, and what I say to them is that we've done some good work together.
Mm.
And so, because they will say, it's really not what I've done, is what you've done. I saw, no, we've done some good work together. And look at where you are right now. I'm, 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 I am just so impressed how you're sticking with it. And so I try to give them that positive reinforcement. They need that. My patients need that because they just
We
don't
all
have,
need that. We all need that.
right.
But I'm
Right.
in
It,
the
it, it,
therapy, in generally in therapy though, I don't even think we train people to be comfortable with the affectionate, loving, positive feelings that you're talking about.
right.
We're so focused on pain and pathology.
Pathology.
Well,
Mhm.
it's not only that, but people are afraid they're going to get in trouble.
They're
And
afraid that they're going to get in trouble.
that they're going to be accused of something. Because
Yeah,
that
there's so much fear.
so that people hide their affectionate feelings, warm feelings, because it's that's not what we're supposed to be doing here, and it's dangerous. What are you trying to seduce this patient or something?
Yeah, I think that's been the underbelly of what maybe is not talked about, like the
Mhm.
fear of love and affection,
Mhm.
especially in
Right.
traumatized people because it's so mixed up. And I think most of the people that we all work with have a pretty profound history of trauma, developmental trauma, complex trauma, kind
Mhm.
of trauma. The trauma that brings them in probably then is also attached to the attachment trauma and the developmental trauma and the racial trauma. And you
Mhm.
probably got a whole like
Mhm.
compendium of trauma nodes that
Right.
you get activated when you have a big T trauma like losing a leg.
Right.
And it's so fascinating because there's one feeling when it shows up in the therapy office that we know things are going to change, and it's love. right? Like Irving Yalom, I think he wrote that book, Love's Executioner. And he said psychotherapy goes great until your patient falls in love, right? And then where
Right.
are they? But when my patients experience love, whether it's they go to church and there's like spiritual movement, or they meet someone and it could be over a cup of coffee, that's when I just see rapid change happening. If they have the permission to like talk about it with me. And
Right.
sometimes I'll be like, oh, that sounds like and I feel scared, a loving exchange that you had, right?
Yeah.
Just to
Yeah.
start naming it, you know.
Right.
A lot of times when I'm working with people and they're telling me about previous relationships, I'll say, were you in love? And they're like, no, I
Oh,
was too young. I said, well, what do you mean you were too young to be in love? Yeah, I was too. It's almost like a phobic word for people. Like,
yeah,
Right.
like,
Oh,
yeah, we're
That's right.
that's part of why I think video or live replays and things are so difficult to get people to participate in, because when you watch it, you can see all this stuff happening that's not spoken about.
right.
And so it can be
All the
very
sweet
hard.
nuances.
I remember being an intern, and this is my discomfort. So I was interviewing this person who was young also, and then we looked at the video later, and clearly we liked each other, but it was like two pretzels talking to each other. We were so uncomfortable that our arms were folded and our legs were folded, and we were talking. It was hilarious.
I'll be on the other side of the room.
I love
I saw
it.
that video on YouTube. It's out on YouTube. The
I
pretzel
don't think so.
psychiatrist. Yeah.
Oh, okay.
The door's right over there. You can get
Right.
it.
So, Jennifer, we have about 4 minutes left. What would you offer to early career psychologists and psychotherapists, social workers, all the therapists? What would you offer? What kind of advice would you offer to early career psychotherapists
Oh,
from?
yeah, numerous things. Number one, I would say thank you for being
Yeah,
involved
thank
in this
you.
profession in the times that we are right now, because
Yes.
they are very challenging times.
Mm,
And now you have to remember that I'm one of those ones that believe in access to mental health care, right? So one of the things that I would offer, and just ask, like, open your doors to all the patients out there, to all
mhm.
the clients, and not just the ones that can pay out of pocket. If you do a good job and you love what you do, the money will take care of itself.
Yes, I agree.
You know, because I'm one of those I'm one of those ones that take Medicare and insurance, and I've hired somebody to work for me to help me, and I do fine. I'm doing fine financially. It takes care of itself.
That's good advice.
Mm,
Yeah, and don't forget the forgotten.
mm,
And because that's why we do what it is that we do.
mhm.
And then, it's really funny. And it's like I'm almost like a snob in working with the ones
Your
with health
tribe.
disparities. Yeah, it's like the disenfranchised. It's like I don't have the patience to talk about, you know, existential life crises things. Like I'm trying to help you. I'm down that we were talking about Maslow's hierarchy of needs. I'm working
You're in
down here with
survival.
the body. Yeah, we we could get up there to that self-actualization, but
Mhm.
self-actualization. So I say what I my advice is stay with it. Stay with it, and remember why you're laughing, because it's like stay with it and why we are in this in the first place. It's okay. It's
Yeah.
gonna take care of itself. You'll have your Mercedes, your house on the beach. You do the right thing, and you'll make a difference with your patients.
That's great advice for young people. Follow your passion and do good work, and the rest,
Yeah.
that's first. So Jennifer, we want to thank you for sharing your expertise and your passion and your intellect and your insight. It was wonderful. We're going to hang around for a couple of minutes. Thank you all for watching, and hope to send it around to your friends so they can
Yes.
watch a recorded
And
version.
your big, big heart.
Yes.
Thank you.
Good night.